Hello, I'm here with Don Lemelle, Dr. Lemelle of Associates in Podiatry. Tell us a little bit about yourself.
Well, I've been a podiatrist for 30 years and I've been in this practice for the last 20 years. My partner in the practice is Dr. Jeff Kane, and we're here to take care of this community.
And we appreciate it. Let's talk a little bit about feet and diabetes. It's Diabetic Month, the month of November. What are some tips for people who have diabetes and foot care, because that's pretty important?
It's really important. Diabetics, the first thing that they should do is they should be inspecting their feet on a daily basis. The reason for that is because as you're a diabetic, you may end up losing some sensation. So we call that diabetic neuropathy, loss of sensation in the feet. So it's imperative that diabetics check their feet on a daily basis. They should take their shoes and socks off, inspect in between their toes, the bottom of their foot, and also inspect the shoes. Many times diabetics don't realize that their shoes are broken down or are worn out, or could have pieces of dirt or grime inside the shoe that can irritate the foot. So they should be inspecting the shoes on a daily basis, turning the shoes upside down and shaking them out, looking at the sole of the shoe, making sure there's nothing piercing that sole that could bother their foot.
And with shoes and your feet, I had heard at one time you should buy like a half size bigger. Is that true, or should you get a diabetic shoe? Or
That's a great question. So you should get a good shoe fitter at a shoe store to fit you with the appropriate shoe. You don't have to go size up. And diabetic shoes are used for the diabetic patients who have neuropathy and are at risk of developing ulcerations from their shoes. So diabetic shoes come with a special liner that's a soft liner that is made to fit the mold of their foot, so they take pressure areas and offload those. It prevents ulcerations on feet, and so it makes patients have less chance or less risk of breakdown.
so when should somebody come to see you if they are a diabetic, or even if they have a general foot issue?
So we'd love to see diabetic patients early on so we can give them an education. And then if they have no neuropathy, we want to see them usually on a yearly basis. Depending on the severity of their neuropathy, we may need to see them every 3 months or twice a year.
And if I have a shoe that is rubbing, sometimes you see a little red mark or something like that. Do you just keep an eye on that, or should they come in and see you if they've had issues before?
Yeah, the diabetics, if they have marks that are not usually there, they should come in and we can take care of it early by eliminating that friction that they're getting, or eliminate them from getting an ulceration by changing the shoe gear.
So you don't want to wait till it's an open...
Oh, no. We want to see early and prevent the problems. It's much easier to fix a little problem than let it become a large problem that's bigger.
And what about your toenails and toenail care if you're a diabetic?
So most diabetics, if they have the neuropathy again, they should come into our office and let us do the trimming, because they won't know when they clip a piece of their skin and open themselves up to getting an infection. So if they have no loss of sensation, they have normal feeling, then they can trim their own toenails, because they're going to know when they do something that they should not have. But we recommend all diabetics with neuropathy come in and let us do that for them.
Now, I have seen on the grocery store shelves or in the big box store shelves lotion that says diabetic lotion or diabetic foot care lotion. Is there a difference in the types of lotion you should use if you're a diabetic?
Good question. Most of the time it's just anything that's going to moisturize your feet is going to be helpful. The hand creams that you have will work for your feet just as well. The only thing that we caution is not use that lotion between your toes, because those are more moist areas where you won't need any lotion. So it should be on the tops of your feet and maybe on the backs where the heels get a little crusty. And any lotion will be helpful over not using any lotion. And the diabetic creams, they have a great name on them and a great title, but they may be more expensive and not be any better.
Well, that leads me to my next question. As a woman, I enjoy getting a pedicure. Is that recommended if you're a diabetic? Is that okay, or is that something you should steer clear of?
Yeah, we don't think pedicures are a great idea for diabetics to go out and have pedicures. Everybody wants to be pampered. You can hit the spa, do your fingernails, but you shouldn't really get pedicures if you're diabetic.
And what should we do as far as eating or any of that type of thing if you're concerned about your feet and being a diabetic?
Well, as you know, for diabetes overall, it's important that your nutrition, that you pay attention to nutrition and you don't go overboard with all the carbohydrates. And so most of our diabetics, and we recommend this all the time, is to go and see the nutritionist and go to diabetic seminars on nutrition. And we send patients to the hospital for that so that they'll know how to count the carbs. The better control you keep of your diabetes, the less likely you're going to have problems. So important things are, your diet, exercise. Your control of your diabetes is really important because the more out of control your blood sugars are and the higher your A1Cs are, the more likely you're going to end up with problems. If you can control that and keep them under 7, but even better under 6, then you're less likely to develop problems. So we see people who have been diabetic for 20 years and they've kept great control of their blood sugars and they have very few problems.
So that's the key, to keep control of your blood sugar. Even though you have diabetes, it's not a future of losing a toe or a foot. If you control it properly, you can live with it and not have any issues.
Absolutely. We have so many patients that come in and they're so afraid because they got the diagnosis of diabetes that they're going to have an amputation. And then they say as soon as you have one amputation, you're going to have more and more and more. Well, that's for people who have not kept control of their blood sugars and have led their lives like they don't have a problem and they aren't going to do anything to control it. So people who take care of themselves and follow their doctor's orders and do all the things they're supposed to do really well and don't end up having problems. And we just are there to monitor and watch and help them along the way.
And I would think prevention and then early diagnosis is the key.
Absolutely. Prevention.
So to wrap up a little bit, they come see you, maybe if they're a newly diagnosed diabetic, just to get a baseline. Would that help?
Yes, absolutely. That way we can have them on a regular schedule. And with computers today, we can set up that 1-year appointment and you get reminders on your phone that you have the appointment coming up, which is really helpful. But that way we keep you in the loop and you don't have to go looking for a podiatrist when you have a problem. You're already in the system and we can keep an eye on you.
And as far as diabetic shoes go, you offer that service here too, right?
Absolutely. I think we're the only office that's offering diabetic shoes in the community. And so we can evaluate you, get all the paperwork that's necessary to have the shoes covered by your insurance, and we can do the fitting and the casting for the diabetic shoes and the inserts.
Well, I really appreciate you taking some time to talk to us today. Good luck to your practice, good luck to you, and let us know next time you have some new news for diabetics. We'll come back out and talk to you.
It's been a pleasure. Thank you very much.
Thanks.